Quick update on the Omicron news. Dr. Gily on this channel, as I often say, I help you make sense of health information. Data about Omicron continues to pour in. Here's a nice graphical representation of how severe the infections with the Omicron variant have been in South Africa compared with infections with previous strains of the SARS-CoV-2 virus. In teal, you see Delta. In gray, there's the Beta. And then in red, in the lower portion of the picture here, you see the Omicron. And then on this vertical axis over here, there are the percentage of people who are on high level of care or in the ICU in the first 25 days of each of these three waves. And as you can clearly see from this picture, compared to the previous two main waves of variants, Omicron so far causes significantly less serious infections, which is good news. We talked about this recently, and to a good extent this is expected based on the natural history with mutation accumulation in viruses such as the flu virus and other epidemics and pandemics that we have seen in the past. Along the same lines, there is a study here that was also done in South Africa by a group of researchers from Germany and South Africa. And what they did, they actually looked at about 8 or so patients. Now, this is interesting, and this is reflected in the title of my video today. What they did is they took about 8 people who have had prior full vaccination series. They had 2 series of Pfizer plus a booster, so they had 3 shots. And here you see the dates listed and everything. Also, one of them had the AstraZeneca, I think the last one on the list here, maybe the 9th patient, has the AstraZeneca series. And what they did is, what's interesting about this guy is that they actually got the Omicron infection. So what this is telling us is the number one, as we feared and indicated before, even with a full series of vaccination, and no matter which one it is, whether it's the mRNA or the old technology or the old platform, one could still get infected with the Omicron variant. So this is reflective of that immune escape that we talked about. However, before we feel despondent and we feel like those of us who got vaccinated that it was worthless, here's a list of the symptoms that these folks experienced over day 1, 3, 5, and 7. And what you see here is that while they were symptomatic, most of them had fairly common, meaning similar to common cold symptoms. You know, headache was a common symptom, fever, nausea, sore throat, cough, especially, dry cough was present even at day 7. This is encouraging, and again, along the same lines, in the lower portion here, you see the graph where these people were asked at every, during the whole progression here, they all follow for a total of 7 days, they were asked to self-rate how severe their symptoms were, from mild to moderate to severe. None of them, by the way, were hospitalized, none of them died. The blue line indicates mild symptoms, and you see a majority of them, sometimes most or all of them, especially as they progressed through the infection, the further along they were, the more likely they were to report that their symptoms were mild. And the moderate symptoms were a minority, but there were a few, especially early on to the middle of the interval of follow-up. One could argue that this is only a 7-day period of monitoring of these patients, and that is true. We know from prior infections with COVID that oftentimes this is a biphasic infection, whereas the first week can be mild or moderate, and people can even start to improve. And then there's a second phase in 15-20% of people where the disease comes back with a vengeance down the road. I think, though, we have data going beyond 1 week now from South Africa where we don't see that happening with Omicron. So that's very encouraging. So what's the take-home message from these findings? Number one, there is some degree of immune escape. This is not new. Fortunately, though, the immune escape is not total, is not 100%, and people who get infected typically develop a mild to moderate form of disease. Now, on a prior video, I mentioned the fact that I don't expect the virus to get worse and worse in terms of virulence as time goes on, and most people agree with this. The reality reflects this. But when I say that, I wanted to qualify that with the following. What we also see in viruses like the influenza virus, for example, which is an RNA virus, been around for over a century, where it's been actually studied quite closely, especially in the last few decades. And so what we see with that whereas new strains that typically develop in the human population, they become weaker and weaker, and some of them go extinct as time goes on, ever so often a stronger strain, a more virulent strain pops out and causes an epidemic, or in the case of H1N1, requires a mid-season vaccination, as you remember a number of years ago. When I say that this virus will gradually become less and less fit and less dangerous, that doesn't mean that such scenarios where we see a pop in virulence and aggressiveness cannot happen anymore. It can. And typically, again, if history is our teacher, what we typically see, or the scenario where we see that most likely happening, is usually when the virus goes into a different host, like in the animal reservoir, which we know SARS-CoV-2 does. It goes in other mammals. And after it makes its rounds there, it oftentimes can even hybridize itself with other forms of coronaviruses and pick up sequences and genetic information that makes it more virulent. And then when it comes back to the human population, it can do so with a much more aggressive profile for a while, and then it dwindles down again. So reality is always complex, and I want to acknowledge that. But that doesn't negate what I said earlier. And I think overall, I remain optimistic for the future that the worst is over. Appreciate your comments. I've been busy lately, so I haven't been able to reply to comments, but know that I do my best to read them, and I appreciate you being part of this. Till next time, you guys stay healthy and you stay wise.